Meanwhile, a warning to Jamaicans this evening as the government slowly reopens the economy. Do not become complacent. The call comes from an infectious disease expert who argues that if the process isn't managed effectively, the country could be faced with a new wave of the virus. Shamela Pullen reports.
With the U.S. reopening its economy weeks ago, they are now seeing a spike in COVID-19 cases in several states. Locally, infectious diseases specialist Dr. Kathy Pate Robinson says with Jamaica reopening its borders to nationals and non-nationals, they're expecting a similar situation. Dr. Pate Robinson says her colleagues on the front line also share a similar view. They fear that with a spike, it might further overwhelm the healthcare system.
The thought of having a massive outbreak with a lot of sick people who need to be in hospital, that's a bit overwhelming because can we really manage that if people are not careful and we do have a massive outbreak where people get sick? We've had pretty big outbreaks, but people haven't gotten very sick. So most have been at home, which I'm very grateful for. But if it goes the other way, it could be more than we could manage.
Dr. Pate Robinson says if there is a spike, the resources in place can only last for a few months.
I know everybody's trying to prepare adequately, and adequately would mean trying to have maybe 1, 2, 3 months of PPE in place available. But that's not always possible. In the setting of COVID-19 right now, getting supplies into the island has been challenging. Getting supplies of medications, getting new PPE, and so it's a constant battle.
Health Minister Dr. Christopher Tufton says while he is aware that the country is at risk for more COVID-19 cases, there isn't much more they can do because there has to be a balance in terms of life and livelihood. But he too has another concern.
I am concerned that for some Jamaicans, we have seen complacency setting in. Perhaps because persons expected the virus to have been more damaging and we have been able to manage it and so reduce the impact. But one should not confuse the efforts of public health and all of society, the government and others, who have been able to manage this process.
And with the borders now reopened to nationals and non-nationals, Professor of Endocrinology and Biochemistry Errol Morrison says while pre-testing these individuals is a good idea, there are limitations.
Even after they have done a test, say they're coming to Jamaica next month and they do a test this month, in preparation, or as close to their date of travel as possible so that they could get a result. In the airport, okay, and in the day-to-day exposure to others, they can easily get, re-exposed.
Dr. Tufton says the risks can be managed depending on the action taken, but he says this requires the cooperation of all Jamaicans. Shamela Pullen, TVJ News.